Gender transition procedures for minors. Missouri Attorney General Andrew Bailey joins us now to explain what they're doing and why they are doing it. Welcome to you, sir. Why are you putting an end to these procedures in the state?
Well, these are dangerous and procedures that are not backed up by science. They're not evidence-based, and they cause long-term health consequences. Both the administration of puberty blockers and cross-sex hormones can lead to blindness, brain swelling, loss of bone density, and certainly the surgeries have irreversible long-term health consequences. And that's why we've seen European nations sharply curtail these procedures in favor of treating a mental health disorder with psychology and psychiatry. And so that's why we're fighting to instill in these providers a sense of the need to resort to psychiatry and psychology to protect children from these dangerous experimental medications and surgical procedures.
What is the plan in place to help some of these minors who might come forward at an early age with real concerns about themselves? How do you help them?
Well, first of all, we've had a whistleblower at one of these clinics come forward and swear under oath that 75% of the children that she treated came in with gender dysphoria because they learned about their gender on TikTok. Think about that for a second. That's a scary statistic. And to the extent that's true, we need to be treating this mental health disorder with clinical psych assessments. And if we're going to go down the road of medication, there needs to be some kind of tracking system for the adverse consequences. Look, that's basic patient care. I'm amazed that any of these clinics were able to operate without doing that before this rule, and we're able to obtain malpractice insurance. So this rule just injects a level of common sense. If we're going to be administering pills or ever referring a patient to surgery, there needs to be real informed parental consent. We need to use psych assessments first, and we've got to track adverse outcomes.
This is just a bit from the study on youth trans care, revealing that there's a lack of current evidence-based guidance for the care of children and adolescents who identify as transgender, particularly regarding the benefits and harms of pubertal suppression, medical affirmation with hormone therapy, and surgical affirmation. What was your response to the revelations in that study?
Well, look, at the end of the day, the emergency rule we've promulgated is absolutely necessary to protect the health and safety of children in the state of Missouri. And anyone can look at that rule and see we have 6 pages of endnotes, clinical studies, medical journals, experts that are all opining the same thing, which is that these medications and surgeries aren't backed up by science and they're dangerous. And I'm amazed that the left wants to ignore that. They're going to push a left-wing ideology masquerading as medicine and ignore the science. I mean, this is the same kind of quackery we saw during COVID, where they pushed a false narrative and ignored the real science. And that's exactly what's happening here. But children are being harmed, and we're not going to let that happen here in the state of Missouri.
Finally, I'll put up a map of the other states that are already having restrictions on youth trans care. You're seeing this in states across the country: Alabama, Arkansas, Arizona, on down to Tennessee and Utah. Do you believe this is gaining in momentum across the country? And ultimately, what is the reaction that you've gotten so far from the move in your state?
Well, very positive, because people understand the need to inject a level of rationality. I mean, look, asking for a psych assessment and to track adverse consequences and let parents know about the dangerous side effects of these drugs, that's just common sense, and people get that, and I think the rest of America does too. Look, Europe has curtailed these procedures because they know they're dangerous, and America needs to course correct now, and I'm proud to be leading that effort on behalf of the state of Missouri. This is innovative. This is a first of its kind in the nation to use this kind of AG authority to promulgate a rule, and I would encourage other states to adopt the same policy.
A lot of them are considering it. Attorney General Andrew Bailey, appreciate you joining us, sir. Thank you very much. We'll keep watching it.
Thank you.
All right.